So the variety of elements, there's many things ego states can be used to treat. I suppose one of the first ones is PTSD. Certainly that's where it was originally used, but also acute stress disorder. People who've just gone through stressful experiences are experiencing that initial traumatic stress. There's eating disorders, so the ego state that is driving the eating disorder, the ego state that is holding on to the emotion, the one that's working, the one that's learned the behavior of pushing down or of eating to push down emotions and so on, which is quite often what something like, for example, bulimia is, or the ego state that's holding on to this strong sense of control, and the only thing it can control is eating, which is the one that you see in anorexia. Similar to eating disorders, but different. Obsessive compulsive disorders, the ego state that looks at, is holding on to the obsessional thoughts, and the compulsive, and another one that holds on to the compulsive behavior or behaviors. With psychosomatic disorders, those disorders where you've got somatization of a disease state, pain or something like that, for which there is no known cause. Remember, no known cause, we must make sure they have been diagnosed properly. And that might be an ego state that's hidden somewhere in the underlying state saying, hello, I want to be recognized and no one's listening to me, therefore I'm bringing this pain about, I'm bringing this issue about, or this habit, this tick, or whatever it might be. And anger, certainly finding the angry ego states or other acting out behaviors like violence, like self-harming, and so on, criminal behaviors, etc. Because it might have something to do with something that happened in their childhood. Certainly addictions, and we have protocols for all sorts of addictions, including a stop smoking protocol, which I find very useful when I've got a client who is quite resistant to to change. Whoops. Complex weight management, yeah, we can do standard weight management, complex weight management, so where people are eating as a means of coping with stress and anxiety, and so on. So the ego state there that comes in, certainly with a variety of mood disorders, depression, anxiety, and it goes on with that. And the one thing we mustn't forget, it can also be used for sporting and other performance enhancement. So it can deal with the negatives, but you can also work with ego states that perhaps have lost contact with the executive, but they're there and they could be used to improve performance in a positive way.